Hi, it's Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. I'm continuing on today with our FAQ video series. I'm up to number 49. What's the difference between using your own stem cells versus a donor? Now, using your own stem cells, which is called autologous, is when you have either some of your fat taken, which is called adipose tissue, or bone marrow. The best source of bone marrow is from your pelvis, so usually it's taken from the back of the pelvis. Now, one of the potential pros to doing that is you're not going to introduce any new disease into your body. There is a theoretical disease transmission if you use donor stem cells. We've never seen it. We've done over 26,000 stem cell procedures in the past decade. So is that really a pro? I guess so. Now, what's the quality of the stem cells when you have the tissue taken from yourself? Now, the stem cells that we have in our own bodies, a lot of them have aged with us, all right? Older stem cells in our bodies are not nearly as active as they were when they were first produced, all right? They've been susceptible to the toxins that we take in from alcohol, smoking, high inflammatory foods, medications that we've taken over the years. So there can be quite a few issues with the ability of those stem cells to actually perform repair and regeneration. The way that I like to describe it is if you take adipose stem cells from, let's say, your belly, you process them in the room and give them back to the same patient, you're basically moving furniture around in the house. Taking furniture from, say, the living room and just moving it and putting it into the family room. So when you look at the stem cells that we administer from umbilical cord tissue, those stem cells are very young, they're very pure, they're very potent, they're very energetic, and they're less prone to having DNA damage like our own stem cells. With the donor stem cells that we use around the world, our scientists have looked at them to make sure that the proper surface markers are in place. They have significant colony forming units, which means they're very, very active. They don't have the potential for oncogenesis. They have trilineage differentiation. Their morphometry, their shape is perfect. So they have all of the characteristics that are going to help get you the best outcomes. So over the last decade, it's become very, very clear to us that the donor stem cells have become more effective than using your own. They're also much more consistent than your own stem cells, whereas we age into our 40s, 50s, 60s, those stem cells become less in number, and the quality of those stem cells is not up to par with regards to the donor cells. So that gives you some idea of the differences. Visit us online today at r3stemcell.com and then call us to set up your free consultation at +1 844 GET STEM to see if you or a loved one is a candidate for one of these revolutionary regenerative procedures at any one of our 70 centers in 7 countries. Thank you.